very important issue. And, uh, life after prostate cancer, basically. And, what I hear from men is that they are, so excited that they have survived cancer treatments and cancer, because they can be so nervous at that time when they are given the diagnosis of cancer. And then they're often told that they may end up with two issues that can significantly impact quality of life, but they think, oh, I've survived prostate cancer, I should be, it's fine, I can deal with anything. But then they realize that these issues that occur after prostate cancer treatments can really negatively impact quality of life. So thanks so much for the great introduction. I did want to say that the radio show is across Canada now. So it airs in Toronto, in Winnipeg, in Calgary, Edmonton, Kelowna, and of course in Vancouver. And I'm also in clinical practice, so I see patients. Mute myself there.
Sorry.
Just in case you wanted to hear what I had to say.
That was my fault. Sorry, Maureen. I muted
fine,
everybody
no
else.
Problem. So I see lots of patients in my office that are suffering. And quite frankly, it is a lot of suffering with leakage of urine or erectile dysfunction or some other issues that are the result of the prostate cancer treatments. And, prostate cancer treatments depend on the size of one's tumor and how far it has spread. And, it's really the stage of the disease and or how likely or quickly that the tumor is going to grow, how healthy a person is, what their age is, and also personal preference comes into play as well. So sometimes people think, oh, I wish I'd had this type of treatment instead of that type of treatment, because maybe I wouldn't have wound up with a leaky bladder, erectile dysfunction, decreased sexual drive and desire, fertility issues, or bowel problems as well. So there are so many ways that prostate cancer treatments can affect your quality of life, and in an area that we don't really talk about too much. We don't really talk about our bladder health or our sexual health. Bring it up at a dinner party. You can talk about blood and gore and horror, and then everyone's into the conversation, and then sex comes up, and all of a sudden everyone goes numb. So I thought I would, or goes mum. I thought I would I start off with the incontinence side. And a leading cause of male urinary incontinence is a side effect of prostate surgery. And so the one thing that's important is diagnosis is key. So depending on what type of leakage that you have, not all leakage is the same. Most men after prostate surgery, after radical prostatectomy, will have stress urinary incontinence, but many men will also have urge urinary incontinence or overactive bladder or incomplete emptying. So it's very important that you have the right diagnosis, because the diagnosis dictates the treatments. And although there is generalized overall good bladder health, still that diagnosis is really important. And bladder health impacts quality of life. It's a chronic condition. It reduces your self-esteem. You lose dignity. There are some drugstores that their number one product that they sell is adult diapers, which just actually breaks my heart, because there are so many other treatments that are available. It'll affect your ability to be physically active. I had a dentist in my clinical practice, and he literally was so depressed. He had his head on my desk, practically in tears, about how leakage of urine had affected his cycling, had affected his life. It affects people's independence, and then they almost have to depend on Depends, which is those adult diapers. So there are many treatments beyond that. And if you don't learn anything tonight, learn that one thing. There's also increased laundry costs, and that can even impact the relationship because of the division of labor in the household. And urinary incontinence is the number one reason for admission to long-term care homes. And so we've learned in a pandemic that the last place you want to be is a long-term care home. And also, of course, it can affect scent and just dignity and self-esteem and how you feel about yourself. And you can feel like you're aging faster or getting older if you're leaking urine. So there are so many incontinence treatments. We often sort of joke around in the office, you know, one is not phone sex because you might actually get hearing aids. Anyway, but there are some behavioral strategies like Kegel exercises and condom catheters. There are some clamps. There's also a procedure in the form of a tape. And also there's a new device that I want to tell you about tonight that I'm really happy has hit the market because it's extremely effective, and it's called the Continence device, and it's a medical device, and we'll get into that a little bit. Oh, we've got a thumbs up for the Continence device. Great. Maybe you should give this talk.
We just know of it. Yeah.
Oh, okay. Fantastic.
I'm not using it yet, but we know of it. We had a talk by Robert Orr, actually, one of our meetings. Yeah.
Oh,
I'm glad you mentioned it.
Okay, great. Yes, so a lot of my patients are actually, delighted having that option for their urinary incontinence. But it's really important overall bladder health, bladder irritants. There are so many irritants: caffeine, coffee, tea, alcohol, of course, certain acidic fruits, vitamin C. A lot of people put vitamin C in their water every day. I don't recommend that. But citrus fruits and fruit juices, spicy foods, tomato-based products, carbonated drinks, and chocolate as well. Spicy foods, if I didn't mention that one. So it's very good to get back to basic bladder health. Constipation is another contributing factor to leakage of urine. And so if you have fewer than 3 bowel movements a week, you may have constipations, or if your stools are hard or lumpy, you have difficulty or pain when passing stools, or that you feel like stool has not passed. So very important to increase the water-based fluids in your diet. And that's important for good bladder health as well. Increased dietary fiber, flaxseed, senna, polyethylene glycol products are very good. There's also urge suppression or bladder retraining. So this is actually good for men who have overactive bladder, and just as many men have overactive bladder as women. It's about 16.6% of the population. We often associate leakage of urine with women, with little old ladies. The marketing is pink, but many men have overactive bladder as well. And you may have had overactive bladder before your surgery, and you may have had it without leakage of urine, and you may now have it with leakage of urine after your prostate surgery. So it may have changed. And so sometimes people just put up with things and then don't recognize it until it worsens or really impacts their quality of life. So for urge suppression, we recommend bladder retraining. For urge incontinence, we recommend urge suppression or bladder retraining. For stress urinary incontinence, which is when people leak with cough or sneeze or exercise or lifting something. We recommend good bladder health, so drinking adequate amounts of water, no preventive peeing, and there is also this male sling for stress urinary incontinence, which is an outpatient procedure. It's done under general anesthesia. It takes about 45 minutes to 75 minutes. Patients have very good results with that. The treatment depends on really how much your issue affects your quality of life. And so if you decide to have a procedure like that, or you may want to go a little bit more as a conservative measure, which is you've had that presentation from Robert Orr on the Continence. It's a discrete medical device. It's inserted into the urethra temporarily. It blocks the passage of urine, and it stops leaks as well. And everyone has a personalized fitting, and it's done in conjunction with a pelvic floor physiotherapist. And the good news is that for the North Shore residents anyway, they're actually in talks with some pelvic floor physiotherapists on the North Shore. So this option should soon be available a little bit closer to home. You can always dial 604-653-0360 to get more information. There's somebody on the other end of that line to help that. But the nice thing about all these options is that they are options. And so you can actually get all the information that you require, speak about it with your physician, with your partner, with whomever you, go to for advice in life. And then you can make your decision, and you can start with the most conservative approach and then go toward a little bit more, as we say, or less conservative approach. So it's great to have all of these options. And sometimes it's just the simple things. And other times it's just a tincture of time is what you need, that these things will get better over time. But there's lots you can do in order to, and to help your bladder situation. Really important to have a good, strong pelvic floor. So Kegel exercises are important for men as well. Exercise is important to also get that blood flowing, and also get that weight off. If anyone has additional weight on them, it's never been more of an important time as well. We've learned in this pandemic to be as healthy as possible. And so a good nutrition plan, low glycemic index, because sugar does affect the bladder as well. It can irritate the bladder. And abdominal weight can also put additional pressure on a bladder, and that can promote leakage as well for people. So it's never really about one thing for bladder health. It's often about a multitude of treatment options, and really hitting it with every option that we have. So bladder health can be really, it's very important, but when you leak urine, you can feel older, you can feel, less sexual, you can feel, less attractive, you can feel like you're alone on the island, really. And it can be highly embarrassing, because you can be at a dinner or at a function or at an event, and you may leak unexpectedly, or you may have to change pads, going into the bathroom, or it's just highly embarrassing. You may have frequency, urgency, and oftentimes people have, if they've chosen a particular treatment where it's a radical prostatectomy, and the doctor will say, well, it's a nerve sparing prostatectomy. So patients will often think, oh, I'm having the nerve sparing one, I won't get that leakage of urine. But really, that area is a super highway of your invisible nerves. And so it's very, very difficult for surgeons to actually be 100% nerve sparing. And so it can be damage to the nerves, and that is what basically has happened. It can also affect your sexual self-esteem. And so we'll get to sexual health, which is the integration of the somatic, emotional, intellectual, and social aspects of sexual being in ways that are positively enriching, that enhance your personality, your communication, your relationship, and basically love. And that's just something else that we've seen in this pandemic, is that relationships are so important. Being connected to somebody, being intimate with somebody. And it's very difficult to be intimate with somebody when you don't feel good about yourself, or when you're afraid that you're going to leak urine. And so it can be, a very, very challenging time. There was a 2010 report on sex, romance, and relationships. And it was a survey of middle-aged and older people about their sex lives. And the major findings were that 3 out of 10 respondents said they had sex at least once a week. 36% of those were married. That was the TEDx talk. It was about sexless marriage, actually. So that's not such a great number. 85% of men and 61% of women said that sex was important to their quality of life. And so this is such an important subject for people, yet it can be embarrassing. It can be taboo. People don't talk about sex. They're embarrassed about it. I mean, we don't like to think anybody is having sex, yet we are sexual beings from cradle to grave. And it's actually an extremely important aspect of life. It improves mental and physical health. There's a release of endorphins. It'll help you sleep better. It can help you to lose weight because you're sleeping better. It can increase your lifespan, and it also solidifies relationships. And so I can't really overstate the importance of sex for people who are in a relationship who want to have sex. If you're in a relationship and you don't want to have sex, that's okay too. But it's something that people don't want to lose at such a young age. Especially with prostate cancer, can hit men in their 40s, 50s, 60s, 70s, and people are still, very vital in those decades of life and beyond, and 80s, even into the 90s. Depending on how they have taken care of their health, that's it's very critical to live a healthy life, and that, it adds to your quality of life as you age. So we have so many myths about sex as well. And one of the myths that applies to prostate cancer treatments is that sex means intercourse. And so this is a time when if you're suffering with erectile dysfunction, for now, because there is hope, that it's a time to explore and to caress and to hug and to engage in other activities that you may not have engaged in the past. Another myth is that good sex means orgasm. Although that's fantastic, it's not always the end result. And you can still have a pleasurable and enjoyable sex life, even if you don't experience orgasm. Another myth is that men can't help having affairs. That's not true either. Women have affairs too. And men may, though, however, men may have affairs, extramarital affairs, when they are not having sex in their relationship. They typically don't want to leave the marriage, but that just underscores just how important sex is for men. And so a lot of men realize that, and it's not just sex, it's intimacy. And I've learned that from my patients that after they've had prostate cancer treatment, they realized how the intimacy was equally as important as the sex. And we don't like to think, we don't think that men care about intimacy. We think that they'll just have sex with anybody, and that's not the case. It's very important to have that connection. We also think that sex should be spontaneous because the movies, we're going to blame the movies for that one. But sex, has to be planned sometimes. And also sometimes you need to talk about sex as well. And the other big myth is that all men have great erections before their prostate cancer treatment. So that's not true either. And if you think back to what your erections were like prior to, and this should be a screening question prior to prostate cancer treatment, what were your erections like? Were they 100%? They're not necessarily for men, even in their 40s, 50s, 60s, 70s. So that also relates to your erections after you have had prostate cancer treatment. So, it's extremely important that if you want to engage in sex, that you continue to seek out the treatments and support, maybe counseling, if that's what you need, because it helps to keep you fit. It helps to lift your mood, and that is so important, especially as people age. A little bit, it can help to keep you lean, but it can boost your immune system as well. And that, of course, is important now. It's as important now as it ever has been, your immune system. And so, especially in this pandemic that we're all living in. So erectile dysfunction is the other very common issue that occurs after prostate cancer treatment. And it's erectile dysfunction is the inability to attain and or maintain an erection adequate for penetrative sex. And so erectile dysfunction symptoms might include persistent trouble getting an erection, or even ever to be able to get an erection at all, or trouble keeping an erection. And this can lead to reduced sexual desire. And so it can also lead to depression and anxiety, but there are lots of other things that contribute to erectile dysfunction as well. They are things like heart disease, atherosclerosis, high cholesterol, high blood pressure, diabetes, obesity, metabolic syndrome, which is a condition that involves increased blood pressure, high insulin levels, and body fat around the waist, and as well, high cholesterol. Degenerative nerve disease can also lead to erectile dysfunction, like Parkinson's disease and multiple sclerosis, or prescription medications, smoking, because that affects blood flow, Peyronie's disease, which is a scar tissue in the penis, alcoholism and other substance use issues as well, and sleep disorders, and of course, why we're here tonight, the treatments for prostate cancer or enlarged prostate. Surgeries, low testosterone, and also psychological issues can contribute to erectile dysfunction as well. So many of my patients are so happy, and at the time, they just wanted to survive cancer. That's really all they heard in the doctor's office, is that, we can treat this, but you may leak urine and you may have erectile dysfunction. So they're so happy. So erectile dysfunction they're so happy that they've survived cancer. They're not so happy that they have these side effects from the treatment, because it can lead to an unsatisfactory sex life, stress, anxiety, depression, embarrassment, low self-esteem, relationship problems, and also fertility issues for those men who have had it in the younger years, and it could certainly strike then as well. So we have medications for erectile dysfunction. I get a lot of guys in my practice, they'll say, yes, the doctor wrote the prescription for a PDE5 inhibitor like Viagra, Levitra, Cialis, but I didn't take it. I thought I wasn't going to be having sex. So hopefully you have learned from the last time that I spoke that it's very important to take those medications that the doctor prescribes. They're giving it to you for a reason. And maybe sometimes even when you're going through, if there's someone you know who's going through prostate cancer treatment, you know, it's a good idea to write down what the doctor says, or to bring somebody along to help, you know, because people are stressed when they go to the doctor. They may not hear everything. So as I mentioned, some of the medications, the Viagra, the Levitra, Cialis, Staxin for mild to moderate erectile dysfunction. And these medications work by enhancing the effects of nitric oxide, which is a natural chemical in your body that your body does produce, and it relaxes the muscles of the penis. And so this allows for the increased blood flow and helps you to get an erection in response to sexual stimulation. And sexual stimulation is very important in terms of getting an erection as well. It's part of it. These medications work best in a testosterone-rich environment, which is another reason that exercise is important, because exercise helps you to build testosterone. And so it's exercise, you know, I cannot state how important daily exercise is for you. And even weightlifting, even just walking, you know, especially if you're feeling anxious or depressed, 30 minutes of walking a day is as good for mild to moderate depression as any antidepressant. And so exercise is so important, in a healthy, nutritious diet as well is extremely important. And, you know, these medications are safe. They're very good for you. They actually help to increase blood flow. They do have some side effects, significant side effects: nasal congestion, headaches, flushing, goosebumps, pounding heart rate. And so that's why a lot of men, you know, don't want to take them, or find that they can't take them because they just cannot tolerate the side effects. And of course, if you're taking nitrites for chest pain, or if you have hypertension or some other cardiac diseases, they are not actually advised for you to take, but your doctor will understand that. And also, some men will tell me that they tried you know, one of the PDE5 inhibitor medications and it didn't work. And I'll ask them how many times they tried it, and they'll just say they just tried it once. And so you have to take it 5 to 6 times in order for it to potentially start working, if it's going to work for you. So you need to give it the old college try and not just take it once. We talk about penile rehabilitation in my clinical practice quite a bit. And what that means is medications plus a vacuum pump plus engaging in sex, or attempting to have sex. And so this works quite well, this option for men. And it's actually, you know, staying the course. And, you know, a vacuum pump is it's a device that is either battery operated, or there's a pump and it actually brings blood into the penis, and then you put a penile ring on for no longer than 20 to 30 minutes. And it's the blood flow that's brought into the penis by the pump that helps you to attain an erection. Now, a lot of guys, I mean, this is therapeutic, but a lot of guys use it as well once the therapeutic time is over. But it's not the sexiest, I guess, is what I'm trying to say, but it's effective, and sex is a great motivator. So engaging in sex, taking that medication, using the vacuum pump, and having sex can be a very effective treatment for men, but it does take time and dedication and consistency. There's also alloprostol suppositories, which are inserted into the penis, into the penile urethra. There's intracavernosal injections, and that's a fine needle with Muse. It's inserted into the base or the side of your penis. It's alprostadil as well. And so there's different options. And so it's whatever you're comfortable with, but knowing that there are a number of different treatment options that you can speak to your doctor about. Additionally, as I mentioned, exercise and psychological counseling, alternative medicines. I'm a little bit leery of supplements, to be honest with you, and I highly recommend that you speak to your doctor about any type of supplements that you might want to try. There's something on the internet. It's an herbal Viagra. It's not. Anyway, there's a lot of times I want to say, don't even waste your money with these. There are many other treatments that work. Kind of an end of the road treatment is a penile implant. So that's if you've tried everything else and this is really affecting your life in a tremendously negative way, then speak to your doctor about a penile implant. There's condom sorry, not condom catheters. Anyway, also other suggestions: stopping smoking. Discuss your concerns with your partner. That's really helpful and really important, because that may help in terms of the relationship. Limit or avoid alcohol. Follow a healthy diet. I actually developed a diet for men with erectile dysfunction they were not prostate cancer patients, but it can't hurt. But men with erectile dysfunction for whatever reason and had added weight on them. And so I called it the all-in diet, in part because one of the first patients that I recommended it to after I developed it, and it's low glycemic index, high protein, low carb diet. He said that he wasn't losing any weight after he tried it for about a week or two. And I said, well, are you following it to the T? He's a lawyer in Chicago. He said, well, no, on Sunday nights we always have Chinese food takeout, and I've been having that. And I said, well, no, I told you that you have to follow this diet to the T in order for it to work. And so he said, oh, and I said, you have to go all in if you want to go all in. But what happens is men, I lose 20 pounds. Men lose weight faster than women do. Although this diet women can use it as well. You can email me if you'd like a copy of it, nursetalk@hotmail.com. It's, men and women lose weight, but you have to stick to it. And it can help erectile dysfunction as well if it's a blood flow issue. Make sure you're getting adequate sleep as well, and deal with any relationship issues that you may have also. So you may seek counseling or psychological counseling or marital counseling that can help as well, because erectile dysfunction can affect your physical health and your emotional health. And it can lead to anxiety, depression, relationship issues, and in other aspects of life. And you want to, really deal with these issues in life so that you can have, have a much better time, basically. And so sexual intervention, which is basically what this is, and and it's hard for a lot of people, I realize, unintended, but it's about attitude and education and the right diagnosis and going to see the right practitioner who has the skills to help you to deal with it. And also it's thinking outside of the box a little bit. And so it's looking at sex in a different way. And maybe it's more about, cuddling and hugging and caressing and, seeking pleasure. There are many, many erogenous zones on the body. And so seeking pleasure in many other ways and making it fun, trying to take the clinical aspect out of it and to remember to make this fun. There are so many different ways in terms of getting connected and everything from food to bubble baths and showering together and just caring for one another in a different way as you work toward treating your medical issues that are the result of prostate cancer treatment. So other ways of expression of love can be fulfilling and very beneficial to your psychological and your physical health as well. So there's lots of resources out there. You can always email me, nursetalk@hotmail.com. There's also always the Prostate Center here in Vancouver, and that's prostatecenter.com as well. But seek out, get your questions answered, and stay on it. Anything in life that requires behavioral strategies, takes time and takes dedication and takes discipline and commitment. But know that you can come out the other side. I have many stories of men who have presented to my clinical practice with, leaking urine in their 50s or a flaccid penis in his 40s, and 4 months after the surgery, and had never taken the PDE5 inhibitors, and getting them back on a penile rehabilitation program. And a little bit of time and a little bit of effort can lead to great success and having things looking in the right direction. Anyway, so if anyone has any questions, I'm happy to take them now. You can always go to my website, maureenmcgrath.com, or tune into the Sunday Night Health Show, 8 p.m. Pacific time, on for a couple of hours. But I'm happy to take some questions.
Okay, either a chat room, or if you guys want to, there's a reactions button at the bottom there. If you hit that, raise your hand, or just physically raise it. If I can't really see everybody on the screen. So either maybe just call them out if you want. Anybody have any questions? I think I'll start with one. The ED question, Maureen, have you heard many guys in your practice talk about, I'm 3 years into it now, and still looking for the results that I'm thinking could happen. I've heard it can take up to 4 years. I mean, have you heard guys say, one guy said it did take 3 years in his case. Have you heard anybody say it's taken 4 years or longer?
Without any treatment at all?
No, this is after prostatectomy.
To have, I'm not sure I understand your question.
It's an ED. ED is a side effect, right? Yes. And I often think the surgeons, I mean, they talk about nerve sparing, but a lot of the guys in our group and that what I've talked to over time, I mean, nerve sparing is kind of a panacea in a lot of ways. And as my surgeon, Dr. Goldenberg, said, you didn't know how to play the piano going in. So I'm not going to, I wasn't able to teach you how to play the piano after the fact, after your prostatectomy. But, I'm still plugging away, trying all the things to try to get the ED side effect to disappear. But it's 3 years into it now. And I'm just wondering, I'm holding out hope for the 4th year. But do you hear much talk of the guys saying, that long, it's taken that long? Yeah.
No, I don't, to be honest with you. I don't, there's not really a time without trying, having a strategic plan, basically, as to what you have tried. I would actually have to look into, what treatments you've, started with, were they utilized appropriately, what length of time, so, but there isn't really this like, oh, just wait 4 years and you'll have erections again. But time is helpful. It may get better after a year, 18 months, but yeah.
No, the incontinence in my case took about 7 months. So I tell guys that to hang in there because, 7 months I was pad free. So doing my happy dance thing. One of the two is not bad.
I would try everything I mentioned. Yeah, but the other, it depends which you would rather have. I would try every single treatment I mentioned tonight. Just start now and start with the most conservative and then keep going. Like, the injections, a lot of guys really, they're a little nervous initially thinking I'm going to have to put in it, using a needle, an injection into my penis, but that's so effective for so many men, and they really like it. The vacuum pump, a lot of guys order that. I provide that for men, and there's a lot of men that have great results with that. So for sure, the urethral pellets as well. Those are very effective for men also. So in conjunction with the other aspects as well. Yeah. So, but personally, I'd have to see, what you have tried and what effect you've had from it.
Anybody else have a question they can call in?
Yeah, I have a question. Maureen, hi. I'm 65. I'm 6 years post brachytherapy. I could be the poster boy for brachytherapy success. My PSAs are virtually non-existent, and I have no incontinence problems. No erectile dysfunction, and I've had an ongoing issue since I was quite young with an incredible solid sleep. I turn off the lights, go to sleep at 11 o'clock at night, and I'm up at 6 o'clock, and I don't have anything that occurs in between. I don't get up, I don't go to the washroom, I don't even remember rolling over. But if I don't get up at 6 o'clock, I have a dream that I have to pee. But I don't wake up, or if I don't wake up, I will pee while sleeping in bed. It's very uncommon, but it does happen periodically. And I'm just trying to, for the life of me, I can't figure out what it is. I don't have urgencies. Normally I can, have full normal control. But if I don't get up at 6 o'clock, well, any thoughts on this?
If you sleep past 6 a.m., you might wet your bed, basically.
Or dribble in my underwear, really.
Or dribble a little bit in your underwear.
It wakes me up and I go, whoop, gotta get up.
Yeah. When do you stop drinking fluids the evening before?
Oh, usually 8 o'clock.
Yeah, maybe cut that back to 6 o'clock. Then at 8 o'clock, instead of drinking fluids, I would sit with my feet elevated above the level, sit with your feet elevated above the level of your heart for 30 minutes. It increases venous return. It will help you to go to the bathroom a larger amount before you go to bed. You may get to that. There's more nerves in the bladder than any other organ in the body. I mean, there's so many nerves. And so it also can be, it could be a sleep urgency that you have. But the problem is you're out cold. And so you don't know, right?
Well, basically, yes. I dream about having to go to the washroom, or I dream that I'm going to urinate, and then I do. That's I can't explain it any further than that. But man, I got to get up at 6 o'clock, or I'm in trouble.
Okay.
And I am a water drinker, so it'd be very difficult for me to not drink water after 6 o'clock. Even now I have a glass of water here. I drink immense amounts of water.
Yeah, you may be drinking too much water. The other thing that you could try is at 6 o'clock in the morning when you wake up, instead of answering the call, squeeze your rectal muscle 10 to 15 times quickly. It calms the bladder down. Just try it. And it's a simple strategy, because when I mentioned all the nerves in the bladder, it takes your bladder fills up to a certain amount, and then it triggers that you have to go to the bathroom. So I would try that. 10 to 15 quick Kegels. So squeeze, release, squeeze, release, squeeze, release, squeeze, release. Don't get up to answer it. Just do that first. If in your dream you could add that, that would be good as well.
Okay, well, I have another problem. I have to go tell my wife she was right. I got to do Kegel exercises. It's just exactly what she's been telling me to do.
Do the quick Kegels, though, and then you're both a little bit right.
All right, thank you.
Okay, you're welcome. Bob had a question. Go ahead, Bob.
Yes, Maureen, for stress incontinence after surgery, you advertise in your clinic a machine that gives you Kegel exercises at rapid pace. Does that work for men?
That's the key. That is the Kegel throne. And unfortunately, men who have had a diagnosis of prostate cancer are not, contraindicated. It's contraindicated in your case.
Okay.
So it's not for men who have had prostate cancer. Yeah, it's not for men or women who've had any reproductive cancers either. So, and it's mainly because it hasn't been studied in that way, but it does work extremely well for women who have stress urinary incontinence or urge urinary incontinence, or for men who have overactive bladder but have not had prostate cancer.
Okay, thank you.
Unfortunate. You're welcome.
Maureen, was it FDA? I remember the time I went with those other, you had a trial or something, and I went out to the clinic there and we tried it. At that time, it wasn't FDA approved for men. Are you saying it is approved now for non-prostate cancer men?
Yes.
Okay.
Health Canada approved. Yes.
Anybody else have a question?
Everyone is doing extremely well. Have people had good outcomes from their treatments?
Yeah, it varies. I mean, there was one fellow who's just joined our group and he hasn't had his treatment yet. Another fellow just had his surgery a couple of weeks ago and he was very, very anxious about making his decision. I personally am 3 years into it and have undetectable PSA so far. In 3 years, it's always less than or equal to 0.008. And then there's everything in between. Like we hear this over and over as support group leaders, Maureen, that everybody's prostate cancer journey is different. And some of us are blessed that, you know, I mean, my oncologist that I saw actually said, I do have there's a high percentage of a possible recurrence, but I have such a positive attitude that hey, I'm 3 years in now and it's slow growing, hopefully. And I got a lot of life left in me still. So. And we try to impart that to our fellow members. You know, we try to share our experiences and make guys feel good. And they say that when they come to the group, you know, they get out whatever they need to get out of it. We just had the talk from Dr. John Olive the other day about depression and mental health and whatnot. And anxiety seems to be such a huge thing now with pandemic and everything else. Right? It's just so huge.
It really is. And then the loneliness factor as well, you know, for people who are on their own, you know, the fear around COVID, the fear around the vaccine. I mean, there's so many issues, you know, having surgeries delayed, having virtual visits is different. You know, there's so much that has affected people's mental health. I had a physician patient recently and he said, you know, we're all just a little bit depressed after this pandemic. And I thought, you know, he's probably not wrong about that. It has affected so many of us in so many different ways that you can't, you know, there's no, and some people have been fortunate enough and other people have been extremely less fortunate. So it's very tough, especially if you're going through any medical issues or medical concerns. You know, it's very, very challenging. But the thing is, you know, there are treatments for urinary incontinence and erectile dysfunction. They're not easy sometimes, you know, but they're well worth it at the end of the day, because both of those will significantly negatively impact quality of life. And, you know, it's just so great. You know, we don't realize what we have until it's gone, you know, especially around leaking urine or, you know, a great sex life that can, you know, come to a halt. But, you know, and it's hard because people do get anxious and they do get depressed and they do get discouraged. But it's just keeping up that hope and keeping, you know, keep on trying, because, you know, eventually, you know, 9 times out of 10, something will work, but at least you've given it the old college try. You know, at least you have made every effort and left no stone unturned. And, you know, and some people might be nervous about a certain treatment, but, you know, I mean, so many people are nervous about getting the vaccine and then they get it and they say, that was it. I didn't even feel it. Did you actually give that to me? You know, and so it's the same thing about some of these treatments. You might fear them and think, oh, I don't want to, you know, insert something into my urethra. But if it's going to allow you to play golf, you know, I mean, why not? It's a very, very small device. And the same for the intracavernosal injections. You know, it's a very, very small needle and it's painless. I mean, honestly, guys, it's painless. I know that you have a little bit of a lower pain threshold. No, I'm kidding. But, you know, it's worth a try, because on the other side, you get such a much better quality of life. And even, you know, taking the time to improve your nutrition or increase your exercise, all of that matters. All of that will help to get you to a better bladder health, better erectile function, and which is also critical as well. But it's not one thing that's going to work. It's 10 things that is going to work for a person. And you might try this and that didn't work, and try that and that does work. So I would say don't give up. You know, there is a light at the end of the tunnel, and, you know, kind of expecting it to just magically change, you know, in a day, you know, at a certain point, you know, this takes effort. This does take some effort. It takes some sacrifice. It also takes some thinking outside of the box or looking at things in a different way than you ever did before. But that's what life is. It's, you know, we're here to enjoy it. Life is to be enjoyed, not endured. And oftentimes people suffer unnecessarily.
Maureen,
Bob, I think Bob had another question first. Did you, Bob?
I got a comment, and it may turn it into a question, but being a support group leader, there was a time I sat down with 4 or 3 other fellows for coffee, and we started talking about the effects of our, we all had a prostatectomy, and sex came up, and each one of us had ED, and we talked about that, and a lack of masculinity was a main problem. Mm-hmm. However, in second cup of coffee, we start talking more, and the subject came out of one of us that, hey, what difference is it that we have ED because my wife doesn't want sex anymore? And before we knew it, all 4 of us had the same problem. Is this a common occurrence when you get into your late 60s and 70s that the female anxiety for sex drops off more than men?
I am so glad you brought that up, because I thought about bringing this up, because you're absolutely correct. And it's not necessarily just women in their 60s and 70s. It can occur. Women can lose desire after having children, during perimenopause, menopause, postmenopause. Oftentimes, the reason for low sexual desire in women during the perimenopausal and menopausal years and beyond is because estrogen decreases in the urogenital tract, and the vagina becomes dry. They may also experience leakage of urine, but it's the vagina becomes dry, sex becomes painful, and that leads to low sexual desire. The other reason is that women actually report more boredom in the bedroom than men do. And so women lose their sexual desire. It can have to do with life circumstances, other medical conditions, but it's a very common factor. And so even if a man has his erectile dysfunction treated and it's resolved, he can go back to, that's why it's important to talk about this with your partner, because a woman may actually be experiencing low sexual desire. And the treatment for low sexual desire for men and for women is the same. We often think that desire comes first, and it doesn't. Desire is actually responsive, especially in a long-term relationship. Other issues may impact. And so what that means basically is that if you don't feel like having sex, but everything is okay in the relationship and you accept your partner's advances, and you enjoy it, we call that responsive desire. And so once women learn that, and men who have low sexual desire as well, and about half the men, about 40% of women have low sexual desire, and about 20% of men. We never think that men have low sexual desire, but they can experience that. So that little bit of education, plus treating their genitourinary syndrome of menopause or their vaginal dryness with either a hormone-free personal moisturizer or localized estrogen therapy in the form of a estrogen cream or a ring, which is a prescription from their doctor, women can actually, resume a sex life, because they understand now that it's not necessarily, they'll often say, I don't have sexual desire, because they think it comes first, but it doesn't. And so those 2 pieces of information can be so helpful for women. The other issue that women get at menopause is because things slow down a little bit, because estrogen is the hormone regulator of every organ in the body. Women may suffer at perimenopause or menopause and beyond with depression as well, and anxiety and loss of self-image. They may have body image issues. They may gain weight as well, especially around the middle. And so that can actually lead to low sexual desire also. So that's why it's important that couples talk together, because this is a time in life when men and women have their own issues, if they're in a heterosexual relationship, or even if they're in a same-sex relationship, it doesn't matter. And all of those issues commonly occur at midlife and beyond, and it can really negatively impact the intimacy and the bond and the love and the self-esteem and the value of the relationship. And it places it at great risk. Gavin mentioned my TEDx talk, which was called No Sex Marriage, Masturbation, Cheating, Loneliness, and Shame. And, which is, it's had 28 million views, but it's a subject that we don't talk about, yet it's critical. And there are so many reasons, and so many people are in sexless marriages, but they don't talk about it. You had the good fortune of being able to share this with your friends, but it took a cancer diagnosis and cancer treatments to have that conversation. But people don't like to say that they're in a sexless marriage. They don't like to say, but they don't even know why they're in a sexless marriage. But getting back to, sex is so important, lifelong, throughout the entire relationship, because there are risks. And of course, it can lead to loneliness. And loneliness is associated with hypertension and a shorter lifespan. So it can lead to early death. And you can be in a marriage and you can still be lonely because you're not having sex with your partner. So it's important to address both sides of the equation, because there are treatments for that as well. But oftentimes this will start in the 40s. It can start in the 30s, and it can be long before a prostate cancer diagnosis that a couple has not had sex. I had a woman in my clinical practice the other day. It was 15 years that she had not had sex with her husband, who she loved. She wanted to stay in the marriage. This is the same story. I had a farmer in Alberta, 10 years, no sex. And his wife had lost interest. And so, he said he would have cheated, but there was nobody for 100 miles around him, being on a farm. And so that leads to a whole host of other problems at that stage of life. I had another woman whose husband had cheated, but they'd been in a sexless relationship for 5 years. They were getting ready to retire. They sold their house. They were downsizing. They had grandchildren on the way. And, so it can really ruin a relationship and hopes and dreams, because that was, a lot of women will say, if my husband cheats, that's a deal breaker for me. But what they don't realize is that, 5, 6, 7, 8, 15 years in a sexless marriage, and women will cheat as well. Of course, if a man doesn't want to have sex, it's even harder on a woman's self-esteem, and because that's the social, we're socialized to believe that all men want is sex. But you raise an extremely important aspect of this whole conversation, and that that dialogue needs to happen. So I really appreciate that you brought it up. But there are treatments for women or people who have issues at midlife and beyond that relates to low sexual desire, just as there are treatments for men who've had side effects from prostate cancer treatments. So,
Maureen, Maureen, can you hear me?
Yeah.
Okay. Do you need a referral to come to your practice, or does one just phone you up and go from there?
Just call me up. No, I'm private, so because it's not, my services aren't covered by the government. But you can just email me at nursetalk@hotmail.com. You don't need a referral from your doctor, although a lot of doctors refer to me. They send their patients to see me. So because it's it takes about, I typically see patients, maybe 1 or 2 times, 3 times, maybe over a couple of months, because what I provide is education for patients. And so I provide them with all the education. I have a platform where I email them. It's all written down, so nobody has to take any notes. And so they understand, because, nobody was really educated properly about sex, because it's such a taboo subject, and, and what to expect in a marriage. And that, women aren't even told that you'll likely lose sexual desire after, having sex with the same person for 5, 10, or 15 years, if a couple is that fortunate. But, that's why that TEDx talk has had so many views, because this is such a common issue in marriages. And, so it's a streamlined process. It's understanding the role each person plays in the relationship, in the couple, and in the intimate life. And, sex is a very, very important aspect of that. And from the men that I have seen in my clinical practice who have gone outside of their marriage, they didn't want to leave their marriage. They just wanted to have sex. And so they they tried and tried and tried, for, 10 years. And then all of a sudden somebody saw them, they were vulnerable, and it happened. And so it can either, if they're found out, it oftentimes will ruin the entire marriage. I was explaining to a patient today that, sex and marriage are two different things. They're silos, but they've been put together. And so it's, somebody will say, well, I was really happy in the marriage, but they weren't having sex. And, of course, occasionally it happens where somebody's having sex in the marriage and they're also having sex outside of the marriage as well. But addressing the issues, there are so many issues that occur. They begin at midlife and they just carry on till women are in their 60s, 70s, 80s. And it's unfortunate because there are so many available treatments. And, and it can improve the relationship, the bond, and the quality of life. So feel free, you can email me, and we can do it by Zoom. I don't use Zoom. I use another platform that is HIPAA compliant for privacy. So we can do it that way, or you can come into the clinical practice. We'll be socially distant and wearing masks, but.
Okay, thank you.
Or you could phone in. You could phone in to CKNW on Sunday night.
Yes, you could do that too.
We should put in a plug for the show. Yeah, 8 to 10 p.m. Sunday nights on CKNW.
Yes.
Yeah, it's Maureen is wonderful on that show. It's just great. You learn so much.
Thank you. Call in on the hotline if you want to spice up your sex life. It's 9:30. I don't think anybody can stay up till 9:30, but that's when I do the back to the bedroom segment.
Hi, Maureen. I've got a question. I've got incontinence, and it's I had brachytherapy 15, 16 years ago. Now I've been on ADT for 3 years, and just in the last 6 months, I think my incontinence has got pretty bad, and I'm wearing diapers. And but I do sleep mostly through the night. I have to get up once a night, but that's all.
Okay.
And I know some of the suggestions you've made probably would help me, like not drink so much and not drink later at night and a few things, but I'm having problems because of the incontinence. I have to go to the bathroom probably every couple hours during the day, or sometimes more often.
Okay.
And I don't know, and there's a lot of leakage too, so. Okay.
Is the leakage with cough and sneeze and exercise, or is it, the leakage, is it with cough and sneeze and exercise?
No, it's not. It just comes on suddenly.
Okay.
Usually, if I'm standing at the sink and running water, then it triggers it.
Right. Yeah, it does. It does trigger it for sure. So do you have an overwhelming urge to go to the bathroom, or?
No, it just comes on very suddenly.
Okay. And, it would be really helpful, to be honest with you, if you would complete a bladder diary. So show me what you're drinking. You would write down, you can email me if you want, and I'll send it to you. You can send it back. Write what you're drinking, when you're drinking it, when you go into the bathroom, when you're leaking, what it's associated with. So a bladder diary is, it has a 30% placebo effect, but it's really helpful in terms of diagnosis. So your diagnosis needs to be made before I could make a recommendation. But if you have overactive bladder, which is frequency, urgency, and nocturia, getting up at night to void more than 2 or 3 times, which is no fun, we call that overactive bladder.
Well, I'm only getting up once at night, so.
Yeah. So it may not, and that you could maybe switch that around as well, just by doing those quick Kegels. But yeah, so not drinking after 6 p.m., just drinking water, 1 cup of coffee a day, no tea, none of those bladder irritants, sitting with your feet elevated above the level of your heart.
Yeah.
But seeing, really getting that diagnosis so that we can, say, this is what is going to work for you.
Okay.
Have you tried any of the clamps or?
No.
And I'd recommend the Bard clamp, which is the one that's been around the longest, and really the only one that my patients
Where do you get that?
works. You can just get it on Amazon. Okay. If you email me, I'll send it to you. I'll send you the link. And yeah, so that's one thing to try. There's a condom catheter to try as well if it's the leakage. But, you know, if it's overactive bladder, you can do some bladder retraining, and that would help as well. Okay. Yeah, and cutting out any irritants, which can really impact irritability.
I need to get back to exercising more too. I know that. Leakage.
Exercise. Everybody should exercise every day. I do.
I know. I've been slack on that recently. So.
Yeah, it's hard. It's really hard to get motivated, especially in the pandemic. And but you just got to get out there and do it. And even walking is great. You know, cycling. You know, paddleboarding. You know, is skiing. Well, that's over now. But, you know, any type of exercise is great, you know, but sometimes leakage of urine can prevent you from exercising too. So that's why it's important to get it treated. But, you know, I'm a nurse continence advisor. There's lots of nurse continence advisors around. And so even if it can improve things for you by 60, 70, 80%, you know, that's a win, right?
Yeah. Yeah. Okay.
Yeah.
Okay. I'll probably send you an email.
Okay.
And Maureen, there was last time you talked, I think there was an incontinence type of underwear. There was a brand name for that, wasn't there? That just washable underwear for incontinence?
Oh yes. Yeah. They kind of
for that one
come and go, pun intended. There is some absorbent male underwear. I'm a little bit more familiar with I'm thinking of the female one, but yes, there is some that'll cut down on laundry costs. I kind of like to treat the incontinence versus, you know, a diaper or something absorbent, but that's more dignified and it'll be more cost effective.
Yeah, I think that was the idea of it, was that, you know, you'd save money on the diapers kind of thing.
That's right. Yeah. Okay. You know, some men leak so much that the underwear doesn't work.
Mm-hmm. Anybody else have questions? Sorry,
I've got a question with regard to the gentleman just talked about brachytherapy and now having heavy incontinence. Did he mention it was 15 years since he had his brachytherapy?
Yes.
He did.
So, Maureen, would there be a direct link to brachytherapy, or is there some other major problem that is causing his incontinence?
Oh, well, it's probably since I assumed from him saying that it was since the brachytherapy.
Yeah, is that correct? Since I've been on ADT, and it's only really been in the last 6 months it's got bad. So
that it worsened. I mean, sometimes it will worsen. Is the treatment making it worse for you?
Well, I don't know. First couple years of the ADT, it didn't seem to bother me, but now it is. I don't know if it's the brachytherapy or the ADT that's doing it or what it is, but right now I'm off of ADT for a while, so I've been going on sessions and off and then on again, off and on again.
And how are things now?
Well, my PSA is doing very well. It's down to 0.08.
Okay. And how's your bladder leakage off of the ADT?
Well, that's what I'm saying. I don't know if it's the ADT that's causing the bladder problem or not. Maybe it's something else.
But when you're off, is your bladder better?
Well, I've only been off now for 2 months, so I don't really know.
Okay.
It's not better so far.
Okay. So that's enough time to figure if it's better or not. To figure if it's the ADT or not. Yeah. So might be more related to the brachytherapy.
Maybe it's the coffee and things like that. So
what's that? Sorry?
Maybe it's the coffee.
How much coffee are you having a day?
Oh, 2 or 3 cups.
Yeah, I would cut it down to 1 and no tea. 1 cup of coffee and no tea.
Okay.
Try that.
I'll try that.
Anybody else have questions or comments? I'm just looking at the time here. It's 8:15. Anyone else?
Maureen, I've had cancer for about 12 years. When I was diagnosed with it, I didn't go back for the results for 5 years. So the doctor was very upset. So by the time they took it out was probably about 7 years after I was, you know, after it was confirmed I had cancer. So it was a high grade cancer. Anyhow, I had a radical prostatectomy, and then 2 years later it came back. Now it spread to my bladder, so they took out part of my bladder. So I say I have TB. It's tiny bladder now. But anyhow, I could never get a good night's sleep in the last 7 years since it was out. Like I wake up every in 4 hours, and then I'm wide awake. I have a hard time getting back to sleep, but I'll wake up 2 times, maybe 3 times a night. Right. To go to the bathroom. Like I'll just have little naps in between. So I'm always constantly tired. And then, well, because they radiated me for 7.5 weeks after 2 years, because the PSA was jumping up high. So I guess they didn't get it all out. Right. So then, well, I was celibate for years because of that. And I guess they say if you don't use it, you lose it. So it kind of, I don't know, maybe it's my farsightedness. You know, well, everything seems to shrink down there. So I don't know what to say, but how important is it to have good sleeps? Or because there are some issues regarding leakage and stuff like that after all these years. Right. It's so important to have a good sleep, because if you're tired, you increase your risk of falls and fractures. And men can also, you know, get osteoporosis and have, you know, basically thin bones. And, you know, also going to the bathroom, especially if you're rushing, it's a great risk as well. You could perhaps try to increase your functional capacity of your bladder. And so instead of answering every call in the middle of the night, just try this. So the first time that it wakes you up, you can answer the call, go to the bathroom. But the second time it wakes you up, don't answer the call. Instead, lie there, squeeze your rectal muscle 10 to 15 times quickly. It'll calm the bladder down, even if you can bide some time, because it's really not necessarily the bladder that is your problem. It's the nerves potentially, because you've been answering that call for 7 years at that time. And that's why you're waking up at the same time 3 times a night, every night. So you want to squeeze your rectal muscle 10 to 15 times quickly. It calms your bladder down. Bide some time. If the urge doesn't come back, you know, even 5 minutes, then 10 minutes the next night. And so answer every other call. And the way to delay that is by squeezing your rectal muscle. So squeeze, release, squeeze, release, squeeze, release, squeeze, release, calms the bladder down. I would also sit with my feet elevated above the level of your heart for 30 minutes before, like 2 hours before you go to bed. Also, don't have any fluids after 6, 7 o'clock in the evening, depending on what time you go to bed, but don't have any, you know, say 3 hours before you go to bed. And so try that, because we call that bladder retraining. And so that might just help you quite a bit. Oftentimes after a prostatectomy, things do shrink down there. You said you had been celibate. Are you now sexually active? Well, I was active just for a short time, and then I struck out the last 5 times. So I think I'm going to be a bachelor for the rest of my life. Now, when you went up to bat the last time, yeah, I realized your bat wasn't working, but no. Did you go unaccompanied to the plate? Did you just expect it to work after having had prostate cancer treatment? Well, it did work for a while, but then it just, yes, but now it's sort of out of commission. Although I haven't tried any pills or anything else. Right, so it was working and then it stopped working. Yeah. And that can be a man's natural course of life as well. You know, it also can be a sign, it's the canary in the coal mine. It can be a sign of heart disease. Do you have hypertension? Do you have any other issues going on? Have you? Yeah, you do? Yes, I do. Well, I've been taking my heart pills there for over a year. You have been? No, I haven't. The heart pills, cholesterol pills for 1.5 years now. And why is that? It's, I don't know, financial. Like, financial reasons. I was supposed to go for an operation tomorrow morning, but I had to cancel today because I've been waiting for 4 months for a check and haven't got it. So I had to just cancel out today. So I'm under a little bit of stress on financially.
And stress. And stress is a huge contributing factor to erectile function as well. So please don't give up. Very important. I would talk to your doctor about the financial issue as well, and that you're not able to afford the medications, and because there could be some compassionate help for you so that you can get those medications. And that's probably tied to the erection function issue as well.
Yeah, I suppose he did give me some heart medications there a couple of weeks ago when I saw him. Just tester pills or whatever they call it.
Some samples.
Yeah, so a few samples he gave me. So
yes, but there are programs for you to get those medications, to be able to pay for those medications.
Okay.
Yeah, so I definitely would do that. You know, honestly, your health is your wealth, and so you see, one thing is related to the next.
Well, I guess they're both bankrupt, my health and that, because I got diagnosed 3 weeks ago with a herniated disc. And then they're going to do a colonoscopy in a couple months there because I had issues there. I don't know, 12 years ago I had issues there where they removed polyps and pre-cancerous stuff there. So I guess old age catches up to you when you're turning 62.
I'm sorry to hear that.
Oh, well, whatever. Life goes on. It's very interesting talk. I appreciate that tonight.
You know, and I love that your health is your wealth. I love that. Now we can hardly see Maureen because it's getting so dark. I think we should probably cut it off here. Is there anybody else that desperately wants to get their question in? If not, we'll let Maureen go. Okay, hearing none. Maureen, on behalf of the Prostate Cancer Support Group North Shore, I want to thank you so much for spending the evening with us. I know it's you know, to take personal time away from your day like this to share with us is just amazing. The amount of knowledge, the education, the questions, it was just wonderful. So again, on behalf of the support group, thank you so much for sharing your time with us this evening. Thanks again.
You're very welcome. Thanks so much to all of you. Best of luck to everyone, and feel free to reach out anytime.
Thanks, Maureen.
Okay,
good evening.
Thanks, Maureen.
Thank you
very
very
welcome.
much.
Thanks. Good night.